Guys, my name's Megan. I'm an ER and trauma nurse, and if you stumbled across this video, then you are probably an ER and trauma nurse, or are also interested in becoming an ER or trauma nurse as well. A little bit about me. I've been an ER nurse for about 8 years, and on this channel I'm going to talk all about ER nursing, the good, the bad, the ugly, the oftentimes hilarious, sometimes the sad, the silly shenanigans, and oh, there are shenanigans in the ER. I came to be an ER nurse a little bit later in life. I started out working as I was in retail actually, decided I wanted to be a nurse, and took a patient care tech class at the community college. I was working full-time at night as a patient care tech, and I had a small child. Was taking prerequisites to get into a nursing program at a community college. Got into nursing school. I actually ended up having to drop out of nursing school and move about halfway through, because it was during the recession. We lost our house, and I moved to Virginia. But I had had enough credits that I could apply for my LPN license. So I worked as an LPN for 2 years while going through a bachelor's degree program. So working full-time night shift as an LPN while going through a BSN program and raising 2 children at that point. Yeah, so it was a long, tough road to get from working a retail gig, then being a patient care tech, then being an LPN, then graduating as an RN, working full-time all the while, and raising 2 kids, finally getting my RN. I did my first year as a nurse med-surg, basically. Actually, my first gig was on a med-surg psychiatric unit. They actually, it was such a hated unit. Nobody ever wanted to go there. The turnaround was awesome. I mean, nobody ever wanted to go there. It was a locked psych unit, but the patients were dangerous, so they couldn't go to a med-surg unit because they were really, really sick. But they couldn't go to a med-surg floor. They were too dangerous, but they couldn't go to a psych unit because they were too sick. So it was a mess. After doing a year there, I was lucky enough to finally get into an ER, and was absolutely hooked at that point. You couldn't blast me out of an ER at this point. I've been doing ER and trauma for 8 years now, and I mean, every ER nurse, every trauma nurse, I think all kind of feel the same way. It's a day without blood. It's like a day without sunshine. I mean, I've had a medic bring me a plastic bag with a leg in it, and I'm just like, ah. You know, not that I want to see people get hurt, but I just want to be there if they are. You know, it's you see all sorts of things, and you know, you love the adrenaline rush. You have, you know, it's instant gratification. You know, you see, when you have a good day and you do your job, you save lives. You know instantly you've saved lives, because they either live or they don't. Whereas when I worked in med-surg, it was days, weeks, you know, before you might see progress. Whereas somebody comes in the ED and they're pulseless, and you get a pulse back, and then they're talking and breathing, it's boom. You know you did good. You did a good job. You know, so that it's rewarding. It's instant gratification. And then there's some very bad days where you lose people, and that's why primarily now I don't work in mixed EDs. I don't like doing peds. I've worked in you know, Washington D.C., Baltimore, Cleveland. I don't like to do peds anymore. I've lost too many pediatric patients, and I don't like to do that. That's why I prefer to work in adult-only EDs. Doing pediatric traumas is heartbreaking, and I've done too many of those, and I don't like to do those. Although now, as my children have grown, you know, my kids are 16 and 21, and I've looked at patients that I've lost, and that have been the same age as my children. So now it's as my kids have gotten older, sometimes, you know, even losing an older person has gotten rough. Whereas, you know, it used to be when you lose a little one that was the same age as my child was hard, but losing any patient is rough. But losing pediatric patients is especially hard, and that's why I no longer work in peds. I prefer to only work in adult EDs, and when you work in major level 1 trauma centers, a lot of them now are specifically, they segregate the peds populations from the adults, and those are the ones I prefer to work in. And I've worked in lots of large facilities that are like that. Worked in county hospitals in the inner cities, which I prefer to work in major urban areas. You know, when I worked at the county hospital in Cleveland Metro, it was, once trauma season hit, you know, 50 degrees, you're gonna get 6 to 10 gunshot wounds a night, and I absolutely loved it. I don't think I ever saw a single STEMI the entire year that I was there. You know, and then I've worked at other trauma centers in more suburban areas that, you know, you might get a couple STEMIs a day. So, you know, it's a different population and different experiences, but, you know, I love what I do, and, you know, it's a great gig. So, if you're thinking that you want to be an ER nurse, and, you know, by all means, shadow an ER nurse. If it's for you, you'll know immediately. Some people, it's the specialty for them, and they'll know right away. There's definitely a difference between an ICU nurse and an ER nurse. We thrive in chaos. One of my best friends that I used to work with was in Cleveland was definitely an ICU nurse. She was very meticulous, methodic, and she would label her lines, and, you know, I'm like, what the hell are you doing? You know. Meanwhile, you know, you've got naked psych patients running around, and everything's going to hell in a handbasket. And she was so neat and methodical, and I'm just like, what the hell, you know? But, you know, we like to cut the clothes off of patients, and things are flying everywhere, and, you know, there's naked people, and everybody's swearing. Most of the time there's more cops than docs in the department, and you know, it's an ICU nurse's worst nightmare. When they come down to the ED, they look around and they're like, this is chaos. I don't know how you can stand it. Meanwhile, when I go up to the ICU, I'm looking around and I'm just like, wow, this is, I could not do this. Y'all are some very neat, organized individuals, and very, very rigid, and I hats off to you. They have to stay with, they get to know their patients, and they're with them for long periods of time, and And hats off to ICU nurses. They are the bomb. I can't do that. I couldn't do it. I want to treat them and treat them, or, you know, we get them, we stabilize them and send them to y'all, because I don't want to know people that well. I want to fix them, stabilize them, and get them out the door. So I don't know. I think that's there's a huge difference, and there's a great need for both of them. But like I said, you know, when they come through the doors and their blood pressure's, you know, 60 over palp and barely breathing, and I just want to tube them and get their pressure up and get them squared away and get them upstairs. And, you know, if we keep them alive and get them upstairs, and bam, I've done my job and I'm happy. That's what I'm there for. So I like that part of the job. So yeah, that's the difference between ICU nurses and ER nurses. So we both have our place, and we both have our specialties. So, and if, you know, we see some things that they don't see. Definitely we see some horrible things, and that's why a lot of ER nurses will suffer from PTSD, and of course we can talk about that in another video. I'm planning to talk about all sorts of things. Anything you guys want to hear about, you know, any questions, any things, you know, maybe I'll do a top 10 list of things you don't ask ER nurses, like or my top 10 favorite patients or least favorite patients, or who knows. Anything you guys want to know, or by all means, put them in the comment section, and I'd be happy to answer. So, all right. Like I said, I'm Megan. I'm an ER and trauma nurse, and I have all sorts of stories to tell, and I'd like to share them with you. So come along for the ride and ask me anything. I got lots of things to talk about. All right. See ya.